Chapter number 10, How to Use Spinal Screenings to Attract New Patients. Spinal screenings have proven to be a marketing strategy that produce a high number of new patients at a relatively low cost for most chiropractic practices. In addition to generating new patients, the people who you meet during screenings help develop your personal network. The more people you know and the more activities you're involved with, the better off you will be. Remember what happens to the people you don't meet: more drugs, more surgery, and other silly medical methods to address conditions that chiropractic alone is best suited to address. There are many different types of setups for screenings. Generally speaking, the more people you screen, the more new patient invitations you give out. The more invitations you give out, the higher the number of people who will come into your office. And the more people who come into your office, the more new patients will begin chiropractic care. My goal when screening is to generate at least one new patient per screening hour. But this is just the base. I have seen hundreds of screenings that generate more than 10 new patients per hour. The following are steps to guide you through the actual screening once you have a time and a place scheduled. Step number 1, setup. When you're setting up a small, medium, or large screening, look as professional as possible. Make sure that you are as visible as possible. If you're using signage, it should be fresh and clean. All paperwork should be first-generation, clean copies. The doctor's attire should be professional. A dress casual shirt or a shirt and tie, or the equivalent for women, depending on the site. Assistants should be in uniform. Golf shirts, khakis work well in most cases. After arriving on site, set up and prepare to screen. I prefer the following equipment for a medium setup: a SAM or MyoVision or other screening device, signage, 2 folding chairs, a plastic spine, between 3 to 5 clipboards, and all the necessary paperwork. I set up the 2 chairs face to face with the spine next to them. I use this area to talk to the prospect and then walk them to the SAM machine or the MyoVision device. Step 2, attraction. While you're doing a screening, your job is to interact with the public. Whether you're at a mall or visiting a private company, try to communicate with each person that you come in contact with. Ask people, would you like to get your spine checked? It takes 2 minutes and it's totally painless. Would you like to have an ergonomic posture check? What's wrong? You would say that to the person who's obviously in bad shape. If the above questions aren't working, or if you want to change the pace, you can also try to engage people in other conversations, the weather, sports, or news of the day, but try to avoid religion, politics, or sex. If you are not screening at least 3 people per hour, you probably should not be at the event, or else you really need to open your mouth more. I know many doctors who are uncomfortable promoting themselves. While you should work to have others promote you whenever possible, if you can't promote yourself, then your progress will be significantly slowed. Step 3, consultation. After a person agrees to be checked, I have them fill out a screening form. I get their address, phone number, and insurance information, as well as what clinically is bothering them. I then ask them about any of the symptoms they checked off. I will go through the PQRST pain assessment and other questions until one of 2 realities becomes clear. Either the person has a health problem that they're concerned about, or they don't. If I'm not sure, I will ask, if you could leave all the problems with your pain behind, would you want to? If they answer yes or have already indicated that they are concerned about their health, I proceed on to a thorough screening. If they don't qualify, I screen them quickly and give them advice to get a full chiropractic exam if appropriate. By the end of the consultation, I know if they qualify, and I also know, number 1, where they work and live, number 2, if they have a problem that they want help with, And number 3, if they have some way to pay, insurance, accident coverage, or someone with a last name like Kennedy. Step 4, the screening. Regardless of how you are screening, SAM machine, EMG, Posture Pro, blood pressure, Metrocom, or other device, the goal is to have the person understand how a posture screening, finding high shoulder, weight differential, red or non-bilateral EMG readings, abnormal blood pressure, poor posture is related to their spine. This damage to the structure or function of their spine can pinch, choke off, or irritate the nerve, which can be the cause of their problem. During the screening, I will perform the test and then explain it to the person, trying to create as many of these connections, I call them physical ahas, as possible. For example, if I'm using a SAM, I set the strings at level for the person's ears, shoulders, and hips, as well as view their lateral posture. Then I explain my findings like this. Mary, if you look at these strings, they represent the level of your ears, shoulders, and hips. Do you see the problem? Your head is tilted to the right, your left shoulder is higher than the right, and the right hip is higher than the left. You also carry your head significantly forward over your body. Lastly, your weight differential is 12 pounds more on the right. If the prospect is there with anybody else, like a spouse, sibling, or friend, I will have the other person confirm my findings. If I'm in a really good mood, I might have the other person actually do the screening. I will also answer any questions right there at the SAM. Step 5, transition to close. At this point, I take the person back to the chairs and grab the spine. I show them that if their spine is out of place, their nerves can be pinched. I may stick their pinky into the lumbar IVF and pinch it to demonstrate. I go on to explain that when this occurs, it may cause symptoms like theirs. Step number 6, the close. I will then use my $1 million close. Over decades of practice and conversations with hundreds of doctors, I have found that using this close on qualified prospects, they have a problem, they want help with, and they live close enough to get care from my office, and they can pay for it, will close at least half. Mary, from the look of your spine, you have some serious structural damage in your spine. If it were me, I would get it examined, and examined thoroughly. In my office, when we examine people, we do over 60 tests to check muscles, bones, and nerves. The exam is designed to tell me 2 things. First, what is really causing the problem, and second, whether or not chiropractic can help it. Normally, this exam is $65 or whatever your fee is, but in conjunction with this event, I've set aside a small number of appointments to provide the exam at no charge. There are 2 conditions to this offer. The first is that you're serious about finding out more about your health, and the second is that you schedule the appointment today for later this week or next week. Don't take one of these if you aren't going to use it. But if I offered you a free exam, would you use it? Note, you may have a different offer than a free exam. I have seen $25 first visits, exam and x-rays working well. I have also seen a DC take a $20 deposit that is returned when the patient shows up for the first appointment. If the person says yes, immediately schedule an appointment, giving them choices to keep them engaged and moving forward. What day is better for you, Monday or Tuesday, morning or afternoon, 2:30 or 5 o'clock? Carol from our office will call to make sure that you know how to find us and to get some additional information for your file. What number is best? Great. The office is on Main Street across from the police station. We'll see you Tuesday at 5 o'clock. Oh, one last thing. Mary, missed appointments really affect us negatively in 2 ways. Is this something that we need to talk about? This is known as the post-sale. If they hedge at all, I will continue. I set aside this time for you, and I will meet with you personally. If there's any reason you won't be able to make this appointment, I would like to reschedule it now. By missing the appointment, you won't only not learn how chiropractic can help you, but someone else who would use the appointment slot won't be able to. Step 7. Post-screening. When the screening is over, pack up, leave, and if possible, go back to the office. Put all the equipment away and record your appointments immediately in your appointment book, spreadsheet, or contact management software, or however you schedule your patients and schedule your time. Step 8. Pre-call. 1 to 3 days before the appointment, I start to pre-call my prospects. CAs can do this, but so can DCs. The script is as follows. This is Carol from Dr. Lloyd's office. The doctor told me that you met over the weekend and that you decided to take advantage of one of our invitation to health appointments. Did he also tell you that this is a no-charge visit designed to see if chiropractic can help you? I have your last name as Jones. Is that correct? Our office is located at 1927 Carson Street, on the south side of the street. Where will you be coming from? Make sure that your directions are specific. The doctor usually runs on time, so if you could show up 10 minutes early to fill out some paperwork, the doctor will see you right at your appointment time. Great. I look forward to meeting you tomorrow. Step number 9, follow-up. I call any missed appointments until they come in, or they tell me that they're not interested anymore. If I can't reach them after 2 weeks, I add them to a mailing list that is contacted twice a year. I try to have at least 8 hours of screening a month with the goal of producing 8 new patients. If you're not getting those results, try reviewing all these steps and make a list of things that you could improve on. The screening process can be blocked at any of these steps, so it's important to identify where you're stuck and what's not working. Debugging is not only important, but essential.